And if our host can please start the webinar virtually. Hold on one second. Microphone test for closed captions, WNYC. Microphone test for closed captioning. All right, once again, will our host please start the webinar virtually? And good afternoon, everyone, and welcome to today's hybrid New York City Council hearing for the Committee on Technology. To minimize disruptions while speaking, please place all electronic devices to vibrate or silent mode. If you'd like to submit testimony, please send via email to testimony@council.nyc.gov. Again, testimony@council.nyc.gov. Thank you for your cooperation. Chair Gutierrez, we are ready to begin.
All right. Good afternoon. I'm Councilmember Jennifer Gutierrez, the chair of the Committee on Technology. Thank you all for joining us for this incredibly important hearing on the failure of New York City's technological response under critical demand. While the highly publicized failures in the rollout of the monkeypox vaccine were the initial inspiration for this hearing, we are also here today to examine how the city continues to fall short in its technological responses to the pressing needs of the public. Understanding the city's past and present failings is essential for preparing for future scenarios in which the city will undoubtedly be called upon to respond to public needs. From 1900 to 1940, New York City had 3 separate independent subway systems. In 1940, New York City purchased the 2 privately owned subway lines with the intention of integrating them. Unfortunately, in addition to the inherent confusion of disconnected tunnels and elevated tracks, New Yorkers were also faced with 3 very different design elements, from signs to maps. As one can imagine, the user experience of navigating multiple transit systems was very confusing. As a result, by the 1960s, the city had invested in an overhaul of the subway maps, color coding schemes, and even font type to simplify the transit experience. The modernization of the subway is an important reminder that our city can and should take on these large-scale design improvements to make everyday interactions easier and better for New Yorkers. We are no longer subject to 3 different types of subway signage, so why should we accept more than 50 different website designs and functionalities? As our city continues to invest millions of dollars in the digital transformation of our programs and services, we cannot allow the mistakes of our past to appear again in our future. New Yorkers deserve better. New Yorkers regularly interact with the city and its agencies through websites and mobile apps. They have become one of the primary ways New Yorkers access city services. The COVID-19 pandemic accelerated a digital transition that was already happening and demonstrated some of the city's tech weaknesses. Buggy software, crashing websites, glitching applications, and poor community outreach are some of the issues that have plagued our city's digital service delivery. However, the COVID-19 pandemic also brought with it unprecedented demand for online services. Students and teachers have experienced broken websites and interrupted services through their ordeals in remote learning, as well as an inability to connect to critical health screenings when they were sent back in person. New Yorkers were unable to access and apply for support like SNAP benefits and cash assistance. Housing Connect was down for multiple days this month. These are just a few examples of how the city has failed to meet the technological needs of the public. Mayor Adams is keenly aware of this need. One of the first things he did was to make a significant investment in the rebranding and reorganization of the Department of Information Technology and Telecommunications, to become the Office of Technology and Innovation. But this wasn't just a superficial redesign. The mayor included a mandate that OTI would serve as the city's leader and clearinghouse for technology projects. Unfortunately, regardless of that investment, we still see significant issues in what should be straightforward service delivery, like the monkeypox vaccine portal, which had many few vaccination sites and permutations than the COVID vaccine portal, for which we already had an existing platform. This hearing will look to answer, among other questions, where is the disconnect between OTI and the city's technology services delivery? What is OTI doing to ensure better responses to our needs going forward? For each agency providing programs, services, and resources to New Yorkers, there are unique application processes, visual designs, accessibility, and security protocols. We are requiring New Yorkers to be incredibly tech savvy to navigate a new process each time they need assistance. And those that need the most assistance are often those that simply don't have the luxury of English proficiency, time, or even an easily accessible and stable internet connection. It's 2022, we can and must do better. We will hear testimony from the administration, experts, and community advocates on the current state of the city's digital services, its past shortcomings, and what steps can be taken to improve the city's online tools, both immediately and in the future. Is Bob on the call? I'd also like to recognize one of our tech committee members who is present today remotely, and that's Councilmember Bob Holden. Before I pass it over to our council, I also just want to say on the record, happy Ecuadorian Independence Day to all my constituents. I wish you a wonderful and beautiful celebration today and this weekend. We will hear testimony today from Commissioner Frazier from the Office of Technology and Innovation, OTI, and Dr. Easterling from Department DOHMH will be available for questions and answers. Yes, okay. I will now turn it over to our committee counsel, Irene Biofsky, to administer the oath.
Thank you very much, Councilmember Gutierrez, and good afternoon, everyone. Commissioner Frazier and Dr. Easterling, please raise your right hands. Do you affirm to tell the truth, the whole truth, and nothing but the truth, and answer honestly to councilmember questions?
I do.
I do.
Thank you. Commissioner Frazier, you might begin your testimony.
Good afternoon, Chair Gutierrez and members of the Council's Committee on Technology. My name is Matthew Frazier, and I'm the Chief Technology Officer of the City of New York and head of the Office of Tech and Innovation. Thank you for the opportunity to testify on OTI's leadership role with respect to technology infrastructure across the city. Here with me today is Department of Health and Mental Hygiene's First Deputy Commissioner and Chief Equity Officer, Dr. Torian Easterling. As you may be aware, Mayor Adams created OTI by signing Executive Order 3 this past January. The order recognizes the important role that technology plays across all government services and combined the city's existing technology-related offices under my leadership. It is marked as an important shift in how the City of New York approaches technology and innovation. Instead of disparate offices operating in silos, OTI now represents a coordinated citywide approach under a single leader with a focused mission to deliver trusted, quality services to city residents. The legacy offices that now report to me are as follows: the Department of Information, Technology, and Telecommunications, the Mayor's Office of the Chief Technology Officer, the Mayor's Office of Information Privacy, the Mayor's Office of Data and Analytics, New York City Cyber Command, and the 311 Customer Service Center. It is my understanding that the committee would like to dive into what this coordinated approach consists of and how the administrative changes impact critical deployment of technological needs to serve New Yorkers. As you can imagine, the technology underpinning the services that the city provides is a sprawling apparatus, ranging from critical infrastructure such as 911 systems to websites and applications that New Yorkers rely on every single day, including nyc.gov. The Access NYC Benefits Portal, and the Vax for NYC Appointment Scheduler. While largely invisible to the average New Yorker, OTI drives efficient delivery of these services 24/7. The key to our approach is that it is collaborative. OTI does not make unilateral decisions about agencies' technology deployments. Each agency has a chief information officer whose expertise is integral to advancing the agency's mission. Where OTI comes in, and where our approach is different than it had been under previous leadership, is that we're moving towards an overarching goal of accelerating and simplifying the delivery of city services, alongside a full-scale modernization of supporting technologies. One way we're achieving this goal is by building out high-quality digital services throughout our Strategic Initiatives Division. The team focuses on improving our user experience practices by making tools that are not only technically resilient and secure, but also serve the purpose that the end users need. In addition to focusing on these needs, we recognize when in-house talent should be used and when vendors need to be brought in. When new agency requirements are identified, we will create a roadmap for decisions on building versus buying, how to procure the tools successfully, and develop standards for future success and implementation. As an example, this approach will be implemented with the first significant technology procurements used in support of the MyCity portal, a single one-stop shop platform with a common digital experience for accessing all city services and benefits. The MyCity portal will create a new standard for enabling city residents, businesses, and visitors to quickly access the services they need. On the back end, we strive to enable agencies to quickly and cost-effectively design and deploy solutions on the platform. This will be built out and applied incrementally with a phased plan for designing, developing, and launching additional individual services. As previously announced, the first phase will include a childcare enrollment portal detailed in the mayor's blueprint for childcare and early childhood education. Beyond MyCity, we're also moving towards streamlined and rationalized approaches to programs across the technology landscape by working closely with the agency CIOs to understand their IT needs, including active IT projects or those in the pipeline. This effort will help expedite future funding requests and cyber budget reviews, and will ultimately identify areas where we can use our combined pooled buying power to lower costs. While we work towards these goals, the city must keep running, and we must stay agile to meet the urgent needs as they arise. The city's been through an unprecedented health crisis over the past several years. OTI and its predecessor offices have heeded the call to deploy technology in support of the Department of Health and Mental Hygiene's efforts to respond to these crises. To emphasize that the point I made earlier, OTI does not make decisions in a vacuum, and we collaborate with agencies on specific requirements they need to deploy a tool that achieves their specific purpose. This remains true in the case of adding functionality to Vax for NYC to allow the public to schedule monkeypox vaccine appointments. When DOH-MH approached OTI in late June to build out this functionality, we got to work immediately, and we were able to support the release of 8,200 appointments by July 15th. This allowed OTI to engage vendors to expand functionality to the Vax NYC platform according to the requirements from the Department of Health and Mental Hygiene. Because we were able to do an adequate amount of testing, the site has not run into significant problems since it was deployed. We have since supported several more tranches of appointment releases. On July 22nd, over 12,500 appointments released to the site were made within 10 minutes of release. On August 4th, an additional 20,000 appointments were taken from the portal within an hour. Note that these numbers not only reflect appointments made via the Vax for NYC website, not through the call center or through the community-based organizations. From a technical perspective, the deployment of the monkeypox appointment functionality in Vax for NYC has been a success. We will continue to support DOH-MH in their efforts as the public health emergency evolves. With that, Dr. Easterling and I will now take council member questions.
Thank you so much. So you mentioned a little bit in your opening statement, Commissioner Frazier, a little bit about OTI. Your office was created by Executive Order number 3 in January, right?
That is correct.
So my understanding of that executive order is that OTI is responsible for providing reliable and cost-effective data processing and communication services to agencies, technical assistance, and support with procuring and managing hardware and software.
Also correct.
Okay. What has been communicated to our agencies from this administration regarding this executive order and about OTI as the default technology services provider?
So from a communications perspective, after executing the executive order, we had a briefing for all agency heads just to let them know and reestablish what the Office of Tech Innovation is and what it does. In addition to that, we did a survey of every agency where we requested feedback of all technology programs that they have running of significant size and scale so we could begin to do an assessment to see areas where we could consolidate, save costs, and areas where we need program management and quality assurance support. In addition to that, Executive Order 3 was one order, but we also had Executive Order 10, which reestablished New York City Cyber Command under OTI and also expanded the responsibility of cyber, not just from a detect perspective, but also to assist more proactively. With that, we've reached out to every agency within the city to request a cyber liaison so that we can get real-time information about cyber threats as they arise and respond to those quicker than we had historically. So in terms of communication, beyond the citywide briefing for the agency heads, we've had one-on-one with our peer agencies to sort of pull in their disparate needs, like what do they need specifically for their operations, and we're working with them every day on any need that arises.
Thank you. And so at this point, you have met with every single agency. They understand what OTI is and the level of support that they could get potentially.
Yeah, so through the executive order and the first briefing that we had, and this is one way that we wanted to make sure that we reached everyone as soon as possible. The first briefing was with every agency head, every deputy mayor, and every senior leader across the city so that they knew what it was. So by virtue of the first meeting, we did meet with every agency head.
Do you have dedicated technology specialists to handle specific agency needs?
Yeah, so one of the things that, and this is one of the reasons why the Office of Tech and Innovation was created. So when you look at an agency need, you have to look at it through more than the lens of just technology. There's technology, there's customer service, there's privacy, there's security. Now, some of these things have a technology nexus, but it's not exclusively tech. So what we did, and one of the first things I did as the office stood up, was we launched our Strategic Initiatives Division. And within strategic initiatives, we built out an agency relationship management function, and we're currently staffing that function to ensure that we have domain expertise, not just in technology, but in the business areas that technology supports. In addition to that, we're also bringing project management and quality assurance vendors on board to help govern our large-scale projects that we have running in these disparate areas. So.
You're bringing, I'm sorry, vendors to fulfill this mission?
Yeah, so in addition to city staff, it's a traditional practice when you look at large-scale systems integration contracts, those that exceed $2 million or so, to ensure that we have both in-house support and outside support to ensure that those contracts stay on track and on budget.
Do you have a sense of when the Strategic Initiative Department will be completely staffed up?
Just like any other agency, we're in the process of hiring, and it's hard to forecast specifically when that'll be staffed up. In its current function, we're supporting all the needs of the agencies as they arrive. So on all of our large-scale projects as of January 1 that's moved forward, the Strategic Initiatives Group has reviewed the financial backing of the projects, the scope, the mission, and making sure that from a resources perspective, they're coordinated and aligned.
Yeah. Do you know how many positions you have within the Strategic Initiatives unit?
So Strategic Initiatives makes up our customer service. It also makes up our program management, and in addition to that, our user-centric app design. So in that team, there's somewhere north of 100 people.
Oh, wow. Okay. So the reason I wanted to just clarify the conversation about vendors is because I'm curious, what is the role of OTI and what is your level of involvement as commissioner in vendor selection processes?
Yeah, so vendor selection and procurement selection, that's something that there are very robust processes in the city that govern that. So we have citywide contracts, we have statewide contracts, and federal contracts that our agencies leverage. And then from there, they submit proposals. Depending on who responds, they have evaluation committees that determine who the best person is to deliver that service. Now, where the Office of Tech and Innovation comes in is when a contract gets near award, we validate and ensure that the people that are coming in to do the work actually are qualified and capable of doing that work. And one of the things that's unique about this current instantiation of what technology looks like in the city is that we now have a holistic view, not just into the financial aspect, but with the relationships that we have with the agency heads. We understand the business aspect of it as well. So when it comes to contract execution, although many contracts may be facilitated by master contracts that OTI holds, it's not exclusive to those contracts. So when new ones arise, we make sure that we actually review those. One of the other things that I'll point out is that as we now have the city's tech authority paired with the city's cyber authority and the city's privacy authority, we work on basic terms and conditions. So when contracts get executed, there are defined penalties there, and there are also defined response criteria when something happens, right? That's something that was loose prior to this administration that we've now put in place.
Thank you. So you mentioned that when a contract is near award, then OTI comes in to vet. Is that correct?
Yeah, near award throughout the process, depending on where. So traditionally now, and this is where we play a game of catch-up. So OTI was established at this point 7 months ago, right? And it's a process much like human development: crawl, walk, run, jump.
There
right?
it is. Yep.
Yeah. So we are still in our infancy stage in crawling. In order to catch, you have to imagine for the over 80 agencies that exist within the city and the amount of programs that we have running through, we had to put a filter in some place so where we can catch things. And right now, we had to put a filter on contracts prior to execution so that if there's something that's off the rails, we can stop it and realign to something that makes more sense. Going forward, and this is for contracts before they even go out for solicitation and where they're at the funding request stage, we've now inserted ourselves into the process so that we can look at the scope of what the project is, look at it in comparison to other projects that are running across the city of a similar size, scale, and focus and mission, and seeing how we can combine those efforts versus finding ourselves in a condition where you have 10 agencies working on a system that achieves the same business function.
Got it. And it sounds like, obviously you mentioned it's still in its infancy stage. I'm curious if there's any level of like benchmarks that you can share of what a vetting process would look like, and like what a flag for you in that process would look like for a potential vendor.
So there's a number of things. So it really depends on the scope of the technology that we're looking at. So if we're looking at cloud-based technologies, we look at terms, conditions, how do they safeguard their data, right? Who's cleared to access the data? We look at the mission of the agency and the sensitivity of the data they provide to those systems, and we ensure that those policies align and the vendor that they selected is capable of providing that level of security and resiliency. In addition to that, we also look at clearing processes, right, and development processes. What's the proposed approach to build a system? The days of building large monolithic technology systems that takes 5 years and costs millions of dollars, like that kind of approach went the way, at least the way of the dodo bird, right? So what we're trying to do now is realign approaches so that we can get measurable delivery faster. So if something is not aligned to what the people expect, we can adjust course and not waiting years to figure that out.
Did OTI validate the vendor that DOHMH selected for the monkeypox vaccine rollout?
So the vendors for the monkeypox vaccine rollout was a vendor that DOHMH had used in this space, and that predates this administration. So OTI's specific role in vetting that, OTI didn't exist when those contracts were stood up, right? So we came forward in January, and these contracts have been in place for years. Now, the scope of work that was provided here, as we got to the point where the vaccine deployment became imminent, we collaborated with DOHMH, we got requirements, and we built on a parallel track the functionality into Vax for NYC.
So I can understand the relationship of the contracts with existing contracts under a previous administration, but during the monkeypox rollout, which was, I would also say it's in an infancy stage of a couple months, OTI did not play a role in vetting even just the maintenance of that vendor.
The maintenance, can you be more specific?
Even just so OTI didn't vet, basically I'm trying to understand if OTI had weighed in, had any input in saying this is an existing vendor, they make sense for this monkeypox vaccination rollout.
Yeah, so I'd say that OTI is the city's tech authority and not the city's medical authority. So when it comes to leveraging partners in the medical space, this vendor had been previously cleared by another administration. And our look at this is that it's a vendor that's done similar work in the city for this purpose, and unfortunately it did not work out this time. What we've done going forward is we've put safeguards in place, so if we were to see something like this again, and we see something where we're deploying a system that requires significant public use, we will have performance testing in place. We will have clearing processes in place to ensure that when it goes out, the public gets the same level of quality that it can expect from other tools that it depends on.
Are there other examples of safeguards? Are there other examples? You mentioned testing, but are there other examples of safeguards that you're implementing from this experience?
Yeah, so the safeguards come from both a contractual perspective. It's like if we're going out and we're looking for new contracts or new businesses, right? In those cases, those contracts would appear before the Office of Tech and Innovation, before execution, and then we can say, all right, what function is this seeking to serve, and do we have someone else that does this, and is the vendor selected to do this actually capable of doing? So from a vendor perspective, we have the capability to review, assess, and determine whether we want to move forward in that direction or not. Testing, and that's both performance testing and regression testing. You want to make sure that the systems that you put out actually meet the scale that you expect, and that in the process of delivering new functionality, that something doesn't break in that process, and that people are already dependent on, which is why VAX for NYC has been a big success. Anytime we touch one of those systems, we've taken a significant amount of time, not just to test the function that we put out, but we want to make sure that we don't break anything else that people already use today. Okay. So testing, contracts, and then also vendor selection, and then one of the things that I mentioned is part of having the city's cyber and privacy authority, making sure that we have terms that are built into the contracts that define how certain engagements work.
And you said terms. Now, previously you said penalties. Are you using that interchangeably?
No, so terms of the contract will dictate if there are penalties involved in the contract for failing to meet the terms of the contract.
Okay, I think so. And this is something that you said is new under your leadership and under OTI, correct?
Yeah, so there was a scattershot approach to this before. So there was a cloud review process, and the city had a cloud writer, right? A cloud writer basically means like if I execute a contract with a cloud provider, that there are terms that they must agree to do business with the City of New York. And when I say it's a scattershot approach, it wasn't universally applied to any one of the contracts that the city pushed forward. Going forward, if it's a tech contract and it has something to do with a cloud provider, that will be pushed forward as part of it. In addition to our cloud writer, we also have cyber writers and privacy writers to ensure that the data that the public trusts the city with, that the vendors that we contract with also take that responsibility seriously, and then from a cyber perspective, they meet the city's minimum thresholds from a cyber capability perspective.
Will there be? So my understanding is that the potential for penalties kind of always existed, but they weren't kind of approached in the same way, contract to contract.
That is correct.
Any of contracts that you're inheriting now under OTI, will that change the way that the contract is honored, or?
So the problem is, once a contract's executed, you have to either figure out if we have terms where we can break that contract, or we have to wait till the next term of renegotiation to insert the terms that we need.
But if they already exist, it sounds to me that they kind of existed already in the contract, they just weren't really enforced necessarily?
No, what I said was, it's scattershot approach, basically meaning that as a contract was executed, not every agency or not every entity chose to include the writers into those contracts. So if they weren't included, we can't retroactively go back and say, all right, now we want you to include it without reestablishing the contract.
I understand. Thank you. So about websites, do agencies at this point, is the idea that agencies create their own websites and applications in-house, or do they hire a vendor to do that work?
It's an amalgamation based on the agency's capability, right? So if agencies have internal application development skill sets, and they use their teams. Now, if they don't, then they contract it out.
What is OTI's involvement in that?
So historically, and if you look at what the legacy DoIT's involvement was, when it came to doing security checks of the websites and actually validating that they were safe for the public to use, that's where that extent ended, right? It's like, we'll test it, we'll make sure it works, and then from there we move forward. From the Office of Tech and Innovation, we're taking a more holistic approach at how we manage our public image. So needless to say, when you look at things like nyc.gov and some of the legacy websites that we have, the websites coalesce more around agency identity and less around services. And as the mayor said publicly, both on the campaign trail and after assuming office, that the public deserves better. And that's what we're working on, better, which is why My City is one of the first efforts that we're doing. My City, from a services perspective, although childcare is one of the first services that we will bring in, childcare is a service that's rendered by 3 separate agencies. which has 3 separate experiences today. So what we're trying to do as part of the overall My City effort and our NYC.gov rebuild, rebrand effort is to create harmony behind the messages that we're putting out, the look and feel of the services as people navigate, and also simplifying access so that you don't have to go to 10 places to get one thing.
We're gonna get into My City in a second. Who
I'm
generally,
excited.
sorry?
I said I'm excited.
Oh, okay. Who is responsible for the maintenance and security of a website?
For the maintenance and security?
Yeah, for any of the agency websites.
Well, it really depends. So it depends on the construct. So if the agency's website is hosted by OTI, meaning it's sitting on OTI infrastructure and it's leveraging OTI resources to deploy, then OTI is responsible, right? If an agency's contracted that resource out and they have a third party that's providing that resource, that website, then it could be a mix of the agency IT shop or the outside vendor, depending on the level of contract that's in place. So there isn't universally true. There isn't something that's universally true for that in terms of who's responsible, with the exception of if it's technology in the city of New York, I'm responsible.
Right. Is there, under OTI, is there a plan to kind of fold in that responsibility of a uniform kind of system for agency websites under OTI? Or in those instances where agencies are already working with a vendor, is that kind of at every agency's discretion?
So I think it depends on where you look. So by and large, most of the city's web footprint, especially the NYC.gov stuff, has historically been hosted by Do It. So that's a mature process that's in place and that the city's used to using. As we go forward in terms of harmonizing look, feel, and design style, and making sure that we have user-centric testing, that's where OTI's role will come in. But for our agencies, those that have the capability, this is a team. This is more of an effort of collaboration. From my vantage point, it doesn't matter what agency you work in. As long as you have a nexus around technology, you're part of the Office of Tech and Innovation.
Right. And have there been instances under this new office where agencies are like proactively reaching out and saying like they'd like a little bit more collaboration from OTI?
There's certainly a large amount of that. It's like whether that's design leadership, whether that's thought leadership, there's a lot of proactive engagement across the agency community.
Do you have a sense of what the average cost to create a website is? That would scale a wide range depending on the type of website. I mean, I'm sure we can have the team pull together some metrics and get back to you depending on size and scale. But certainly a website that's for advertisement or putting out information versus a services portal, the cost between those two are wildly different. Right.
And then based on the projected user community and like that could also be an impact.
So can you? Oh, sorry. Go ahead.
So please go ahead.
No, what is the projected cost for the childcare portion of My City?
The projected cost for the childcare. So we're currently in a scoping phase, and we're using internal talent to build, right, at the moment. So in terms of the outsourced cost and what we expect the vendor component of this to be, we have not tripped across that as yet. We're keeping it minimal by using internal talent to build.
Okay, so you don't have that number yet?
No, it's not as we're not using vendor support and we're using internal support, we'd have to take a factor of what the human cost of our employees are and then get that back to you.
Commissioner, when agencies' websites are down, do they, whether or not they're using a vendor, do they communicate with OTI to let the agency know?
They do. So the citywide service desk maintains a availability portal of what services are up or down. And for many agencies, they leverage the citywide service desk for their internal help desks and management functions. So in those cases, OTI is notified.
Okay. What are some of the common website or app or mobile app errors that you see or that your office has collected in the past, 7 months?
So the common, can you just a little bit?
Yeah, so like what are so HPD's Housing Connect was down not too long ago, right? So in that instance, based on what you're saying, I'm assuming that through the grapevine, you and your team will have been communicated that the website is down. I'm not personally aware of what happened that day, but I'm curious in those instances where you are contacted, what are some of those like issues, right? What are some of the reasons why a website that contacts you is down? What are some of the is there a common thread, or is every agency down for a completely unique reason?
I mean, when we look across the technology landscape, it could be anything from high availability failing. You have a network outage within the facility that impacts one of the web front ends. It could be anything like, infrastructure failure. I mean, depending on the age and the deployment type, there are a number of factors that provide that. I can't say that there's a common thread that afflicts every website, because if there were, we would just address that. But a lot of what we deal with is managing legacy infrastructure, right? Infrastructure that's been in place, services that's been running for years, if not decades, and getting to the point where we need to refresh that stuff.
Is there you may have mentioned this, but is there a citywide help desk for tech support?
There is.
There is. Is that just for agencies, or is there a hotline or a system where New Yorkers can use that same number to report issues that they're experiencing with a website or a mobile app?
No, so for the most part, that the citywide service desk is an internal service for city agencies. In addition to the citywide service desk, we have 301 available for quality of life complaints, and then also triaging where to find access to certain services. And then also on nyc.gov/311, the resources that our 311 call out center operators have access to, the public also has access to.
So that's the only system right now for a New Yorker, paying a parking ticket, for example, runs into some issue, which has happened before. Their only recourse is filing a complaint with 311. There's no kind of immediate tech support that they can contact.
That's correct.
Do you have a sense of, with the current system, which is having New Yorkers call in 301, do you have a sense of like what the average response time is? How long does that person have until they hear back regarding their service request?
So it really depends from agency to agency. 311, as the responsible entity for 311, we take calls in, and when we take call, we distribute it to the agencies that are responsible for meeting an issue. Now, agency to agency, those response times vary, depend on severity and complaint type. So we could follow up offline and provide a breakdown to council of what our average response times are by response type. And I think that might provide the information that you need, but sitting here, I can tell you specifically for that condition what that would be.
So I bring it up just because I think anybody on a website that has any kind of tech support, there typically is a pathway for them to communicate with that website that there was a technical issue. What I learned from our last hearing with 311 is if someone is having a technical issue with their 311 complaint online, they are directed to file that complaint with 311 anyway. So I guess what I am kind of wanting to encourage you all to consider is something that's a little bit more uniform and more streamlined in these instances. I know that for the monkeypox vaccine rollout, folks were calling our offices, or because they were not sure. They were like, I don't know if it's my internet connection, I don't know if it's the website. So they kind of felt like there was no central place for them to even find out. Before 30 minutes after the website went up and it crashed, before that information was public, folks were scrambling because they were not sure what they could do, who they could call, and so they started to tweet, they started to call our offices. And so is a more streamlined system or tech support for New Yorkers something that OTI would consider as an additional service?
So certainly we would consider it. The one thing I'd point to is when we look at an entity like 311 that's existed for the last 2 decades, and that we spent a lot of time both advertising and making people aware where they can provide quality of life and service complaints. We can look at things that can supplement that, but when messaging campaigns around a mature service like that seems to not do the trick. Introducing additional numbers and complexity may hurt us more than help us, but we will certainly look at it.
Yeah, I mean, as a regular user, I believe that going onto a website and there's a tech support and there's just one number for all in my interactions with agencies, I would feel that seems more streamlined and more efficient. But
that's what 311 does today.
But 311 doesn't provide tech support.
Oh, you mean like?
Yeah, that's specifically what I'm asking about.
It depends, right? So if you're trying to apply for a specific service, you could call 311. talk you through how to get to that service. In some cases, if you have issues around navigation, 311 can also help with that. But in terms of a general tech support line, 311 is not positioned to do that. So you're correct from that perspective. But basic technical support, 311 can provide where to find it, how to navigate it, submission process.
But what if the tech support is needed for 311? I get what you're saying.
Yeah.
I just, based on the experience that constituents had with this vaccination rollout, it feels a little disjointed to tell people to then call 311 for tech support, especially when they're kind of in the middle, not understanding if the issue they're having is their own internet connection or like the actual website has crashed.
Yeah, so I think in that front, we can certainly look to do this, and by no means am I saying what we have is perfect, but there are ways that we can optimize and we can get better, and we will explore all of those ways.
So for the internal help desk that you provide for agencies, do you have a sense of how many of those calls OTI gets monthly or weekly, however you can quantify that? Do you have a sense of how many times agencies are reaching out to the internal help desk?
So we can follow up with a report for you so that you can see the specific monthly metrics. Now, it moves up and down depending on whether there's an application release or whether there's maintenance that's going on across the system. So for the specific metrics, we can follow up.
Yeah.
But in terms of volume, we're fielding tens of thousands of calls per month.
Okay, wow. That's significant. Can you, and you shared this a little bit before, but can you outline a little bit more of the testing that's done for websites and mobile apps before they're released to the public? Now, under OTI, what are some of the testing that the agency does? So
there's security testing, so where you actually do code review to make sure that what you're putting out, we look for all known vulnerabilities through major cyber tool sets. In addition to code and vulnerability scanning, we also do performance testing. We want to make sure, when I say performance, it's load testing to make sure that if you hit a website with 1,000, 2,000, 10,000 concurrent users, what experience does that person have? We also do functional user acceptability, user acceptance testing, and functional testing. Does the website move in the directions that we expect it to move? Is there any bug that we see, and how can we remediate those kind of things? But those are, in broad strokes, security testing, user acceptance testing, load and regression testing are the big buckets of testing that we perform.
And this happens with every website or mobile app that is under OTI right now, or is there instances where the city kind of does this, like an audit of all the city websites?
So there's a proactive scanning, so security and vulnerability scanning of all the city's all the city's websites, right, to just look from a security perspective. In terms of testing, the distinction you put out as the Office of Tech and Innovation, a lot of what we're doing is established going forward, right? Now, historic lookbacks and periodic testing of existing assets that are already out, that's not currently on the forefront. It's how do we look forward and we pull everything else into what we're doing now.
Can you share how much web traffic our city's websites receive each month?
I can get you the specific volume. Just one sec. But NYCC.gov gets, where did it go? So is this specific to Vax for NYC or just across all of New York City?
So that would be my follow-up question, but I'm curious, just overall, if you have that number, and then I wanted to ask what the web traffic was on the day the monkeypox site went live and crashed.
Yeah, so for New York City, for NYC.gov, our traffic between August 10th, 2021 and August 9th, 2022, it's about 298 million page views. 128 million site visits, and the average page view per site visit, it's about 2.3.
Wow. Would you be able to share or get to us what was the web traffic on the website, on the VAX website, the day of the monkeypox rollout?
So as previously mentioned, the VAX website was not hosted by the Office of Tech and Innovation the day it crashed. So the specific volume and load on that website, I would defer to my colleagues at the OHMH to get to you. I can tell you for VAX for NYC, Between January of this year and July, we had about 2.5 million page views.
Page views. Thank you. I'd also just like to acknowledge Councilmember Gail Brewer, who has joined us. I want to shift a little bit. Cyber Command is responsible for establishing and regularly updating cybersecurity policies. Although there are cybersecurity protocols in place, some of them have not been updated since 2014, is my understanding. Not uniformly. I think my understanding is that some of those policies have been updated since 2014. Can you confirm that, or?
It's possible. So when we look at cyber policies, the reason why some of them may not have been updated is because they may still be relevant. There are approaches that have changed, like you said, cyber liaisons, requirements around minimum levels of cybersecurity tooling. There are policies that we have updated in terms of vulnerability and how we test email and things along that lines, phishing testing. And in some of the policies, if they have not been updated since 2014, it's quite possible that those specific policies are still relevant and good policies. So Cyber Command is led by Kelly Moan, our citywide Chief Information Security Officer, who is very capable and spends a lot of time working with the cyber community across the city to ensure that we are aligned, not just with the high standard from a government watermark, but we're a high standard from the global operating watermark.
I'm a little concerned that a cyber security protocol from 2014 might still be relevant, considering kind of what the experiences of that the DOE had not too long ago, that the city's parking mobile application. I guess I'm concerned. I just don't see how that's possible, but you are the commissioner on that. How can you ensure that vendors are even following these protocols?
Yeah, so I think you point out two things. The first thing that you point out in terms of historic failures of websites. Now, this administration took seat in January, and I cannot attest to the practices that led to the conditions where those websites had issues. And I can't really criticize the people that sat in those roles, because the people that sat in those roles were the only ones that were aware of all the factors that caused them to make the decisions that they made. Moving forward, one of the things that I mentioned earlier on was around the cyber rider, to make sure that all contracts that we execute has those cloud terms and agreements. One of the things that you pointed to earlier was DOE and what happened in that particular situation. Now, our partners at Department of Education and OTI are working very closely to ensure that things like that they don't continue to happen. Key here, I'm not sure if you ever heard this before, but a smart person learns from their mistakes. A wise person learns from the mistakes of others. So we seek to be wise, but we're smart in every interaction. So every time we trip, we learn to make sure that we don't trip again. In those particular cases, if we had some of these reviews in place prior to execution, if we had some of these terms in place prior to execution, we would not have had the issues that we had in that particular case.
Right. No, I agree. And so this is why, I'm curious, is there, just kind of in this conversation that you and I are having right now, are you interested in looking into what are those existing protocols from 2014 that maybe could benefit from a review and an update? So
the question supposes that we haven't reviewed it, but what I'm saying is Kelly Moan, who's the CISO for the city, when I say very capable, and we've done a comprehensive review of all of the underlying policies around cyber. And for the ones that still exist from 2014, it could be that those policies are still relevant. But what I will commit to council is I'll take this back, and I will provide confirmation that anything that exists prior to the start of this administration, that it has relevancy in today's cyber market.
Fantastic. Thank you. According to Local Law 89 of 2020, Cyber Command has to regularly train appropriate city officers and employees on cybersecurity policies. How often does Cyber Command train the agencies and their staff?
So there's citywide mandatory cybersecurity training that every agency must complete annually, every city employee must complete annually. In addition to the citywide cybersecurity training, we're taking a more proactive step at training resources. So with the cyber liaison request that we put out to every agency, we also instantiated a cyber academy. So we work with entities like the federal government to understand how they take federal agents and turn them into cyber professionals. And we built a curriculum to help build that dexterity within the city itself. Needless to say, technology market's a hot job market, and we have a lot of talent within the city. We want to grow cyber talent in the city. So to do that, we are investing a significant amount of time and energy in training the city's cyber workforce. In addition to making sure that every agency, every employee knows that when they get a message saying that, you know, send me $1,000 and I'll give you $10,000 back, they don't reply to that message.
Okay. I just want to kind of go back on the conversation of the writers and kind of what those new writers mean for agencies. Is there any other mechanism to ensure that vendors are following the protocols?
Apologies. Any other mechanisms besides
Yeah,
the writers?
besides the writer. So is there any other, so I'm like, I don't want to spend a lot of time on this particular piece, but like I'm thinking City Bridge, for example,
Okay.
where there was like a violation of a contract, for example. In these instances where you are working with a vendor, are there examples besides the writer? No, wait, excuse me, I'm going off. Are there examples with city agencies as you're helping them kind of update their new policies where there's other mechanisms that are in place to ensure that they're, you know, that they're being tested, that they're being safe other than the writer?
Yes, certainly. So there's a cyber spend review that looks at the financial aspects of any program, large in scale from a technology perspective, right? So that makes sure that as we're spending, we're aware of the cyber responsibility to ensure that those systems are safe. Beyond that, there's also security testing of applications as they're commissioned to ensure that they align with the city's security practices. There's an architectural and engineering review board that takes a look at city systems that are commissioned and to ensure that they're aligned with industry's best practices. So along the way, not just at the contract phase, but actually as systems get built, there are safeguards put in place to actually test what was committed in the contract to ensure that it aligns with our expectations.
I also just like to acknowledge Councilmember Eric Botcher, who's joining us. Thank you. I also wanted to ask, in the instances where OTI is testing websites or mobile apps, do you have a sense of how many OTI since January, how many of those websites or apps you've already kind of proactively scanned?
So apologies, can you repeat the question?
Of the kind of the proactive scanning of the security vulnerability scanning that you mentioned earlier that OTI is doing, do you have a sense of how many of the city websites have been scanned?
So we do indeed. Unfortunately, I don't have that stat with you. What I can share is the vulnerability reports that we get out, so you can see it's not just a periodic scan. We have weekly and nightly scans of our critical infrastructure, so we'll make sure we share those metrics with you.
Thank you. Okay, now I'm going to ask some of the monkeypox vaccine rollout questions, and then you all let me know if you have questions. And thank you once again for joining and for being available for questions. So Commissioner Frazier mentioned that the monkeypox vaccination rollout was under DOHMH, so OTI was not responsible for the vaccination platform to begin with. Was OTI consulted on this rollout? And if not, kind of what was the decision there to have DOHMH just roll through this vaccination unilaterally?
Got it. So I'll take the first part of that question, and then we'll see if that suffices, and then we can continue on if that makes sense. All right. So the Office of Tech and Innovation was consulted by the city's doctor, Dr. Vasan, right? When we knew, you know, the vaccines were imminent, inbound. As we looked at it, with another public health crisis on the rise, there were many conversations around how we can get the functionality in and how could we get that incorporated into the Vax for NYC portal. Now, we started in a parallel track in moving our development efforts towards building the capability into Vax for NYC. But again, with vaccines inbound, there were decisions made by the Department of Health and Mental Hygiene to push in a direction with the vendor that they already had on board to do similar kinds of work. Again, the urgency around getting access to the vaccine as quickly as possible to the people that needed it. From a technology perspective, we had a projected estimate during this point of, was it 3 weeks to get the functionality into Vax for NYC. And because of the demand and the urgency, and given what had happened, we were able to pull that into 2 weeks while working and completing all the performance testing and all the things that we typically do. So short answer is yes, we were consulted, and there were many factors at play that caused what we experienced.
Thank you. Were any of the folks that were responsible for the COVID-19 tech and operations portion consulted on how to best roll out this platform?
So the COVID-19 tech rollout team, again, was from a previous administration. So I could not attest to those that were in the decision-making, that had decision-making power and that experience. Here, we have a team of people that has maintained Vax for NYC and that has maintained all of the other systems around this particular effort that had been consulted, and that this is how we got to the state where we are now, where we have it incorporated into Vax for NYC, which has been a very successful release.
Do you know who in City Hall or in this administration is responsible for making the monkeypox platform rollout decisions?
So when we look at things from a public health perspective, there's one authority for public health, and that's the city's doctor.
That is the
city's doctor, right? He makes the decisions on what's best in the best interest of public health.
And so you would say that he was responsible, well, not responsible, but he was the top decision maker in kind of putting a stamp of approval on the platform, on how the website was going to be able to have New Yorkers come in and sign up for vaccines.
Yeah, so in this particular case, I'm not certain that I have to say that because he said it himself publicly, and I think that there's testimony on that covers that.
Can you, or Dr. Sterling, can you please name the vendors that have been contracted to date for the monkeypox vaccine website?
Including the existing operator?
Yes, so from the moment the city said we're going to need to provide vaccines, just a list and a timeline essentially of who those vendors that were selected were.
Sure thing. So would you?
Yeah. First, let me just say thank you to the chair for having us here today, having the Department of Health join Commissioner Frazier, provide responses to the question and answer period, and thank you to the council for having us. And so specifically to your question, one, I do want to make sure that we sort of set the record straight a bit. We did not contract with any vendors for this service, particularly because you're asking about some of the technology services. These are vendors that we already had relationships and our existing contracts with because of their ability to provide vaccines. I think it's important for us to sort of ground this in, the moment that we were in late May. We had our first case for the monkeypox virus. And I do want to also just state in the chamber, going forward, I'm going to use MPV instead of monkeypox.
What is it?
MPV, the shorter version, just to acknowledge the virus. So in late May, we had the first case in New York City. And then in early June, we started to think about what our vaccination campaign would look like. And I think it's also important to acknowledge that at this time, we only knew that there was going to be a limited amount of supply related to the vaccines. Number two, we did not have any knowledge of whether or not there were going to be additional doses that would be available to the city. And number three, there was no federal strategy at that time. The federal strategy did not become available till late June, exactly June 28th. And so it was imperative for us to lead by example, because we knew, and we've seen this in previous outbreaks, that often New York City is at the center of many of these outbreaks. And so we wanted to make sure that we were going to mitigate spread of this virus, and two, we can get vaccines quickly into the arms of New Yorkers. And so as I mentioned, early June, we began to have conversations, and that included consultations with OTI about what our opportunities and what our approach could be. We started to think about, essentially working with our existing vendors. And so to your specific question, the first vendor that we began to work with is MedRight. This was a contract that we had already established in 2021 and able to get out vaccines quickly to New Yorkers. And then the second vendor that we began to work with was Affiliated Physicians. And that contract was actually established in 2020. Both vendors we have worked with during our COVID vaccination campaign, in-home vaccination, schools, and other congregate settings as well.
I understand. So there were existing contracts with both vendors, and during the decision to roll this vaccination, it was just an extension, essentially, of an existing contract?
So this is not an extension because this is work that essentially that is happening. They're already supporting our COVID-19 vaccination campaign in a number of different areas. AP has been providing our baby vaccine campaign throughout this city, and they continue to support that as well. And so this is scope that we know that they're able to accomplish.
So was this decision to utilize these existing vendors, one based on that existing relationship? Was it efficiency? Was it just the easiest? Like, I'm curious kind of what the thought process behind just leaning on these two vendors that you already had a contract with for this rollout.
Thank you for the question. So one, I would say, is the public health goal, right? Preventing spread and getting vaccines quickly into the arms. Acknowledging the moment that we're in, limited supply. This is a pilot of 1,000 doses at that time. Early June, we were only told by the federal government that because of limited supply, the city would only receive about 1,000 doses. We did not know how many vaccines would be available after that point. And so we wanted to move with urgency to ensure that we were going to get vaccines out to New Yorkers. And being able to set up that infrastructure, these are vendors, as I've already mentioned, that were existing. And so this was the best route in sort of getting those vaccines quickly.
Can you share what funding, whether city, state, or federal, was used to fund the vaccination website, the MPV vaccination website?
So I do not have all of those numbers, in front of me. But what I can say is that the contract that was already established was part of existing city funds that were being used.
Yeah. So just to dovetail in the doctor's response, when you look at how federal funding is provided, it's provided as reimbursement to activities that's already gone, that have already taken place, or expenditures that you've already incurred. So it could very well have been an amalgamation of both city, state, and federal funds. But again, like all of our COVID efforts and all the technology efforts surrounding that, we are very thankful to our federal and state partners for providing subsidies for helping us push these efforts forward.
Do you have a sense of what the vendor cost for the COVID-19 vaccine portal, once it was moved under OTI?
Apologies. The total cost for deployment for the COVID-19 portal?
Yeah, once it was moved over to OTI, yes.
I can follow up with council and provide the details of all expenditures associated with that program, but not a problem.
Thank you. Dr. Sterling, or Commissioner Frazier, excuse me, for either one of you, can you share what were the issues that prompted DOHMH to contract, not to contract, but to use two different vendors for this vaccination rollout?
Certainly. So again, just going back to the timeline. So as I mentioned, in early June, we began to have conversations about how we were going to administer the pilot of 1,000 doses in New York City. Through our existing contract, the decision was made to leverage MedRight because this was already a contract that was already in place. We stood up our sexual health, our vaccination campaign at our Chelsea Sexual Health Clinic, which is our temporary MPV vaccine site. And it went well. We were able to administer all of those vaccines. Now, of course, we saw that the demand outstripped the supply because we only had 1,000 doses. So there were no website issues at that time. But as we saw that demand was increasing, and as I've already mentioned, in late June, the federal strategy came out, as well as additional information about new tranches of doses that were coming to the city. We knew that we need to re-engage OTI to think about what those capabilities would look like for scheduling regarding the MPV vaccine doses. And as the commissioner already mentioned, the timeline that was provided, we were told 3 weeks, but they were able to accomplish this within 2 weeks. And so really, kudos to OTI to be able to accomplish that. But we still wanted to get out the doses that we had in our coffers. And so we moved forward with MedRight once again in early July. And at that time, we did see tech issues happen during that second time when we released doses. Essentially, they did not deactivate a link. And so at the time of the release, there were already, the appointments had already been booked. And so at that time, we moved forward to move away from MedRight and then work with a second vendor, Affiliated Physicians. And so once we released the third tranche of doses with Affiliated Physicians, that's where we saw the second issue. But I do want to just note, overall what we have seen is that we've been able to get out tens of thousands of doses of vaccines out to New Yorkers. And so these were the two issues that did happen, and it was really important. We've learned a lot. We're certainly trying to improve our capabilities and continue to work with OTI to ensure that New Yorkers have the information they need to get vaccines.
Thank you for that timeline. Can you share how much time or how many days since MedRight was managing and maintaining the site and the site crashed, and then the agency decided to move to Affiliated Physicians? What was the time lapse between that crash and the decision to change vendors?
So as the commissioner mentioned, this was all happening simultaneously. So as we have seen that those issues began to occur, we were already engaging OTI and talking with them about those issues. So I would say within days that we were understanding what was happening with the release of the doses, we were already sort of talking about what the next steps would be to work with another vendor.
So do you have a date when OTI started to work on Vax for NYC for this rollout? For this vaccination, sorry.
So the conversation started in mid-June. The specific day where work commenced was June 29th. The specific day where work was completed was on July 13th.
Okay.
And the evening of July 14th, the functionality was introduced to the public. So, which brings us right under our two-week mark.
Can you share if there was any transition between the previous administration and that COVID vaccine platform, and now this administration, this new agency, and then this vaccination rollout? Was there a transition process? Was there, were there any kind of conversations or discussions around kind of what happened with the 2021 platform at the end before OTI? Was there any transition?
Yeah, so as part of any mayoral transition, outbound administration performs a transition memo so that the agencies or those that are assuming control are aware of recent decisions that's been made, things that require attention and so on. So we as part of the mayoral transition, there were conversations around COVID, as we're still in the middle of a public health crisis.
Thank you. I'm going to shift over so that my colleagues can ask some questions. We're going to have Councilmember Gail Brewer and then Councilmember Eric Botcher for some questions.
Thank you very much, and I appreciate what you're trying to accomplish, having lived through Bloomberg and de Blasio on some of these topics. So my question, though, may not be relevant because it is a smaller system, but I know years ago with the child care centers, technology for the nonprofit was as challenging as it was for the city. So in your case, you don't have that many, I would say, entities in the field, but I just want to know, do they have what they need in order to address the technology issues? Obviously, you just have your health centers, I assume, but if you could just help me to understand that that's not a problem, that they have the funding, they have what they need technologically. Obviously, when you're contracting with nonprofits, that's often not the case. But I was just wondering if maybe there's no issue here, but I wanted to understand.
So, in the Department of Health and Mental Hygiene, very similar to all of our other agencies, when it comes to support and services capabilities, they have a support desk that can triage internal complaints around systems, which extends to their CBOs that work with them, that are consumers of the systems that they leverage. But does that answer the question, or is there?
Yeah, I guess I have been no complaints, because often, not with your, but certainly with other DOH contracts, there's plenty of complaints. So, health daycare centers, as an example, they just don't have the capacity to do some of the work that comes, sometimes they can't even handle video because of the lack of support in terms of their hardware.
Yeah, it makes
So
sense.
that's what I'm saying. That kind of, sometimes those little things can trip you up.
Makes sense. So in addition, for this specific vaccination effort, COVID-19 and MPV, there's a service, there's a support desk that's available.
24 hours, that's a 24-hour?
Sorry, it's not 24 hours. From a cost perspective, it doesn't make sense to keep it 24 hours. Most of our operations happen during normal business hours, and by the time you get to 10 p.m., 11 p.m., call volume really dips off until 7 a.m. So we operate during peak operating hours, and we have extended hours to catch those that have early or late starts.
Okay. And the help desk, I should know this is operated by the city?
It's a mix of city resources and an outsourced call center.
Okay, so it's coordinated with 311, is that the idea?
That is correct.
So they have CUNY students, King, and city.
Yes.
I know every one of them,
Oh,
because I was there at the beginning when they all were hired. I used to hire them, the CUNY students. So my question, all right, so you're saying that there haven't been that many complaints in terms of the providers. The other one is a health question, and it's overall global, and maybe it's the wrong question, but for both COVID and what do you call it, MPX or whatever, I like to call it monkeypox, whatever your acronym is, it seems to me that despite all the challenges, people have been getting free health care in the most basic, fabulous way. But then they never go to a doctor, they never see a health professional, et cetera. So my question is there any way without HRSA and privacy concerns being violated, et cetera, to think about this is more for Dr. Easterling, how we can address the health concerns of all of us. I'm the worst, never go to a doctor. God forbid I go to a doctor. But I'm not unusual in that sense. So I'm just wondering, are we taking all of this information? Is there anything we can do to say this is a group of people who have really taken, it's great that the city is offering this health free of charge. Is there anything we can do to help it as a society improve the health care? Now, maybe there's no way, and because we can't get their names, we can't use a database, that's against the law. I got it. But I just didn't know if you've been thinking about this. I think about it a lot because people really got vaccinated, thanks to you. And now what?
Well, thank you for the question, Councilmember Brewer. We do. We think about this all the time. I mean, this is essentially the work that we have to do as a public health agency in partnership with our colleagues at New York City Health and Hospitals. We are a safety net, and we need to ensure that no one is left behind. And so even though I'm a doctor, I'm a public health professional, and I think the starting point is prevention. And I think that also leads to good health and ensuring that our neighborhoods really have all of the resources they need to keep people healthy. And it also means that individuals are getting vaccinated. And so we have a very robust infrastructure to ensure that folks are getting vaccinated. And I think this is where you were heading with emerging and re-emerging infections across the world, and they're certainly showing up within our city lines. I think we have to make sure that we're messaging how important vaccines are and doing all the things that we know are helpful. Secondly, we're working with our health and hospital colleagues to ensure that as we're messaging out about our vaccines, that we are circling back around to make sure individuals are getting access to healthcare services as well. And I think that messaging is really important, not necessarily from a surveillance point, but making sure that our providers, our hospital systems, but then our community-based organizations have access points. And lastly, I will say, I think this was a really important investment. What we did to evolve and leverage our test and trace infrastructure, our T2 infrastructure, to evolve to public health core, ensuring that the neighborhoods that have been hardest hit by COVID-19 now have community health workers, both connected to H&H, but also to community-based organizations. We have over 80 organizations that now have community health workers. And I think these are the type of access points that are going to be really important going forward.
Do you have any way of evaluating if more people have a primary care doctor or health and hospitals, health care insurance? Do you have any way of evaluating what you're saying?
Absolutely. I mean, these are the indicators that we look at on an annual basis, and we're certainly happy to follow up with you. I mean, certainly from an insurance rate, what we see across the city, as well as individuals who are impaneled with primary care providers. This is why we work with our healthcare systems to make sure that we have this type of data.
Okay, I mean, I hope you're right. I know you're trying. And the other thing is, I know maybe the chair asked about this, but we've been hearing about My City for a long time. So I just was wondering the status of it. I know you're working on it. I think there's a bill that somebody has put forward. I just don't know if it's actually going to happen. I'm more cynical than you. I am cynical. I've been doing this too long.
Yeah. So luckily, both the mayor and I are in the business of making those that don't believe into believers, right?
Uh-huh. Mm-hmm.
Right? So
And I'll sell you the Brooklyn Bridge. Go ahead.
I mean, I could try. I don't know if you'd buy it from me. So where we're at with My City right now is we're in our user acceptance testing phase of it.
Okay.
So what we're doing is an application, a human-centric design. We want people to look at what we're building before we actually deploy it so that we can actually get feedback on whether it meets their expectations or not. Okay. So the first phase of My City, which is expected within the fall, is around childcare. Coordination.
Funny that I should mention that.
Yeah, see, coordination of benefits around childcare. Now that's the first instance. But the key of what we're doing here is across the city and all of our data, we want to do one sort of fundamental thing, is we have to start treating the people of the city not as customers to individual agencies, but as a customer to the city. So building a common index of how we identify a person, how do we identify a building, a household, and property is what we're doing in the first phase. And like I said, fall of this year, you're going to see the first wave of My City go out.
Okay. The only reason I say that with childcare centers, it's ironic that I should mention that, but they often don't have the hardware, period. They just don't. They don't have the money for it. And then the small businesses, which I assume eventually as customers. So during the pandemic, I went to, I don't know, seems like in Manhattan, I went to every single business in the borough of Manhattan. And the bodegas in Washington Heights have zero computer, not even, often not even a cell phone. So if you are the business bid, you have to go door to door. Maybe you can text, maybe. So what I'm trying to say is as you do My City, the end product is who's the customer and what do they have, and are you going to pay for their hardware? I don't know.
Yeah, so
I just bring that up because that's where the rub.
No, so you raised a very important topic. So what you're touching on is digital equity, making sure that as we make digital services available, the people within the city have
Your customer, yeah.
To those services, which is why we're doing a number of things to ensure that in the areas that are that have access to the least historically, that we do things to bridge that gap. So we are very in tune to areas where the city's historically fallen short, and we're working very diligently to ensure that we don't repeat those mistakes.
Okay. And also I understand that Madam Chelsea might be leaving, and I will say that is the worst thing I've ever heard in terms of information, and she's been the greatest thing that ever came to the New York City Department of Health. Thank you very much.
Yeah. Let the record show we all concur.
You all wish you could get that kind of clap. Thank you.
Thank you, Gail. Next up, we have Councilmember Eric Botcher.
Good afternoon.
Good afternoon.
I'd like to review the sequence of events leading up to July 11th when the portal went down, the MedRight portal. And just so I'm clear on the timeline, in early June, the Department of Health and the Office of Technology and Innovation met, and the decision was made to use the Vax for NYC portal, that had been used for COVID-19. But that wasn't going to be ready for some time, so the decision was made in the interim to continue using MedRight. Is that correct?
Specific timing on June 29th, the decision was made to incorporate the functionality into Vax for NYC, and that's when the build started. The projected timing was expected to take 3 weeks, which would take us into the week of the 20th of July. We actually delivered a week early, and the functionality went live the evening of July 14th.
Thank you. And were there any concerns raised that the MedRite site might not be able to accommodate the volume of people seeking vaccine appointments?
As Dr. Easterling pointed out, MedRite and AP, the teams that they had partnered with to do this, were teams that had done similar work across the city historically to do this kind of thing. There was, given previous performance, decisions were made to use them again. And if the city had seen something like this similar to what we saw, then other decisions would have been made.
Were there any events in the past with MedRite that were similar to what this was, where you had so many people at an appointed hour accessing the site at the same time?
Is that specific to this administration, or are you asking the previous administration?
The Department of Health, I mean, what prior experience had happened with MedRite that might have led the department to think that this would work?
As Dr. Easterling has stated, and he can go through the levels of service that MedRite is still actively performing. Although this is one failed instance, they've been a partner to the city in many other ways. And if you want to go into details behind the where they're also providing service.
Yep, that's absolutely right, Commissioner, and thank you for the question, Councilmember. MedRite is a contracted vendor that we've been using since 2021 in a number of different settings. Our in-home vaccinations, and so really getting our COVID-19 vaccine out to our elderly, supporting our school vaccination program, other congregate settings like long-term care facilities, really working with this vendor. And so, really these are contained populations and making sure that they're getting the vaccines out. Again, this isn't a vendor that really focuses on scheduling capabilities, and so this is something that we did ask them to do, particularly for this rollout.
Do you think that anyone at MedRite should have potentially have flagged that their own site might not be up to this? How many appointments were offered on July 11th? Like 1,200? It wasn't many.
Right, I think we had about 1,000 doses.
Yeah, and tens of thousands of people potentially trying to access the site. Do you think anyone at MedRite should have said, hey, maybe this is going to be a concern, and did they know that this many people might potentially be accessing the site at that precise moment?
Well, I cannot speak for any individual at MedRite. What I can say is that in working with the vendors, there were a number of different things that we did to assess user experience, such as accessibility, user testing as well. Certainly we didn't explore surge testing, and so we've learned from our errors. We certainly want to continue to improve upon and make sure that we get this right for New Yorkers, and I think that's the focus.
And I think, I want you to know that when I ask these questions, it's because I represent a district where many thousands of people did have a very bad experience that day. And it's more than just not being able to get a vaccine that day. It really erodes trust in the whole system. And for many people, this is their first experience interacting with the city or even seeking this kind of health care. So I think we all acknowledge that it was a very regrettable incident and we're moving forward, but I really want to make sure that we learn every possible lesson that can be learned to make sure that this never happens again. And based on what I've heard today, I think that a lot of lessons have been learned, and I'm pretty confident that the department going forward is going to avoid this in the future. Last question. On the MedRite site, and you should check this out for the future, and maybe this has been raised to you. When you're making an appointment, you select an available appointment, and you're entering all your info. By the time you're done entering your info, that appointment could be gone. That doesn't happen with Vax for NYC. It doesn't happen with Ticketmaster. Is Ticketmaster still around? Why is that the case, and can that be fixed for anyone who uses MedRight in the future?
When it comes to the capabilities of MedRight's portal and the way the technology works, we will look at them in the areas where they provide services for the city to ensure that that functionality has parity with the other services that our people within New York City currently experience. So we will take that back and look at any areas where we're leveraging MedRight for vaccine distribution to ensure parity.
Thank you.
Yep.
And Councilmember, I do want to just go on record and acknowledge, and I thank you for raising it. We have learned from our mistakes, and we are committed to doing better going forward.
Thank you, Councilmember Bottcher. I wanted to kind of pick up right before we had Councilmember Brewer ask questions. So the previous question was about transition. You shared, Commissioner Frazier, that with any administration, there was like a transition memo shared, and there was no specifics about what, I'm assuming that the COVID-19 VAX platform was included in the transition memo. Were you aware of any of the issues that MedRight and or affiliated physicians portals had while they were working the COVID vaccine platform?
None of those specific details were incorporated in the transition that I received.
Wowzers, okay. This is a little bit about what Councilmember Bottcher just asked about kind of the login and the amount of information that's required. Was that a piece, was that something that OTA had tested? So I'm assuming you knew of the fact that New Yorkers had to create a login and like the amount of time that would take?
Are you referring to specifically to the MedRight portal?
Yes.
No, so the functional testing of the actual portal itself wasn't something that the Office of Tech and Innovation performed.
Say that the last part?
That's not something that we performed. Functional testing of the portal.
You didn't test, okay.
No.
It's my understanding that the COVID-19 vaccine website is a Salesforce product. Can you confirm that?
Salesforce is a platform that you can build on. Salesforce, the platform, underpins a lot of not just the city's websites, but a lot of other websites. Salesforce themselves has not productized Vax for NYC. Vax for NYC was an effort led by the City of New York, done with internal development teams and with vendor resources as well.
Who has the contract for the current monkeypox site on Vax for NYC?
So the current monkeypox site underpins, it sits on top of the existing COVID-19 Vax for NYC contract. So the contract is currently held by MTX.
MTX, okay.
Yeah.
In the face of another need for mass vaccination, are we prepared for an efficient or speedy solution using existing partners?
Yeah, so I believe if you look at our response to the existing outside partners aside, if you look at our response to the existing MPV demand, being able to deliver that capability within 2 weeks is faster than you would get if you pulled someone in from the outside to try to do it, even if they brought their own tools with them.
I'm curious, what kind of recourse is available to the city when a vendor, on the example of MedRight, when they're not able to perform in the way that the scope requires them to perform? I think in this instance, it seemed like because both vendors were existing, it seemed like relatively seamless to move from one vendor to the other. But what happens in those instances? I'm assuming there was some portion of a budget allocated for that specific scope of work that we don't know what it is right now. But is there a legal action that the city takes? Kind of what happens in that instance to hold MedRight accountable, besides taking them off of this vaccination rollout?
Right, so as the good doctor just pointed previously, MedRight was contracted with the city to do a number of things. It's just within the scope of work with which they were existing doing some other stuff. Typically within the city, depends on the contract. Your contract, as I mentioned earlier, the terms of the contract upon execution are the things that govern performance associated with the contract. So failure to meet those terms from a contract-to-contract perspective are defined within the individual contract as it's executed.
And is there anything that you can share about what that contract would look like for MedRight in this example, in the monkeypox example?
I would defer to my colleagues at DOHMH who could provide a copy of the MedRight contract and the scope of services and work that they perform. But I think neither one of us at this moment can tell you about the specific terms of that contract.
That is correct. And just to also add, as the commissioner mentioned, and I said it before, I mean, this was the scope of work that they were doing previously. We quickly moved away from MedRight, and I think that's important. And also, we had them issue a public apology immediately once these errors were identified. But we can certainly circle back and provide a little more details on the scope of work that we had contracted MedRight to do.
I'm curious more specifically if there was any impact on the cost of their contract, and that sounds like something you don't have now, but I would really like to know kind of where the tax dollars were impacted by the need to move, by their error. I'm totally fine with a public apology. It happens, but I'm curious, since I know we don't have the total budget right now, the total cost, I'm curious if there was a decision or an instance where you look at kind of how the scope was created or expanded and kind of what the responsibility of MedRight is now that they've, publicly apologized, have admitted that there was a huge error, have admitted that they didn't have the capacity to roll this out well.
Yeah, so as you mentioned, we do not have those details and cannot speak to it today, but we can certainly circle back with you.
Thank you. Has the city taken any steps to ensure that critical public health services that require New Yorkers to register for this service are done under OTI?
Yeah, so going forward, all initiatives that are of this size and scale will be done in partnering with our agencies, but under the guidance of the Office of Tech and Innovation.
Fantastic. And in these instances, will OTI be doing the testing?
So yes, we will take part in testing. And again, depending on the structure and this type of contract that's executed, there may be capacity for testing built in. In those cases, we'd oversee to ensure that the testing aligns to our standards.
And will the vendor contract be with that particular vendor and both agencies, or the relevant agency under OTI supervision?
Yeah, so we operate as one city of New York, right? So it doesn't matter if the contract is under DOHMH or if it's under OTI directly. After Executive Order 3, from an oversight perspective, as I mentioned earlier, it doesn't matter whether an entity sits within an agency itself. If they work in technology, they're a part of the Office of Tech and Innovation.
And that only applies to new contracts?
New contracts.
Okay. It will not, right. Because, so I think it's important that you say that, and it's important that it's emphasized on record, because for me, this would be an example of where OTI could have played more of a role in the vendor selection process and the contract process, but that's not what happened. So it sounds like...
It's for new contracts going forward.
Because we've learned so many lessons. No, okay. As you testified, the monkeypox vaccination portal is under Vax for NYC. The website collects valuable healthcare data from New Yorkers who are trusting the government with their data. Where is that data stored?
The existing website?
Yes.
So the data is currently stored in the cloud.
In the cloud. Who is the cloud provider?
Yeah. So the cloud provider underpinning the Salesforce platform is Amazon Web Services.
Okay. And so they're the ones responsible for securing the data?
No. So,
or is it Salesforce?
No. So where data lives, right, in terms of who is responsible for securing the data, although it sits on a platform, it doesn't mean that the city isn't responsible for safeguarding the data. Any system that we put out, we as a city put out, we are responsible for ensuring that it's secured and the data lives and is handled in a way that aligns with city policies. So ultimately, the city is responsible for ensuring that it's secure.
Is that the same example for any data collected through the Department of Education and their websites?
Yes.
Okay. So there was that breach incident in March through the Department of Education, their high school application process. So what can you say about ensuring security, data security, if we're using the same model for the Department of Education and any of the agencies, or this example?
Yeah, so I'd say in this particular case, and thank you for the question, in this particular case, when we look at what happened at Department of Education with Illuminate, there was several factors that came into play. If there was a period where we did an actual cloud review to look at the platform as it was selected, if we had terms and conditions that were aligned to the city's acceptable practices in that space, these are all things that we could have done to deter like that. But unfortunately, this wasn't the case. Once the city had become aware of the breach, we worked very closely with the team at Illuminate to understand scope, scale, blast radius, and then from there remediate the conditions.
Thank you. I want to move to Housing Connect. The website was down for a couple of days this past month and a few other times this year. Who is responsible for this outage and who is the vendor?
So in its current instantiation, who's responsible? The operating entities for Housing Connect is the Housing Preservation Department, HPD, right? And the specific vendor that's in place, the contract is currently up for renewal. And although a vendor has been selected, the contract hasn't been awarded as yet.
Okay.
All right. So historically, there was a vendor that had the contract, but as this one is near award, we can follow up once the contract is actually executed to let you know who owns it going forward.
And as far as the vendor selection process, OTI will be involved?
That is correct.
And in the instance where this vendor, I don't know how long their contract has been for, but my understanding is that the Housing Connect website has been down numerous times, not just this year, but in the past. Are you looking at those instances as a benchmark that can count against them, even being able to renew their contract with the city?
Yes.
Thank you. Okay, thank you. Okay. The mayor publicly announced his plan to have my city, the Unified City Portal, by late 2022. Is that still the timeline? I know Councilmember Brewer asked that, the launch
mayor,
of it.
Yes, so the mayor announced as part of the child care and early childhood education blueprint that the first aspect of my city would be the child care portal, which we expect in late 2022, which is still on track for delivery.
And is there a vendor selected already, or a short list of vendors that you will be working with?
The work is currently being done or being led by internal resources, meaning like city staffed employees or building. So at this current point, when you look at vendors, depending on how you define that, there could be one, there could be many. Platform, security, like there isn't one prime vendor working on this at the moment.
What I guess for this portal, for this one-stop shop, how and who will be making the decisions about what is being built into the portal?
So it's done as a committee. So those that have the business ownership responsibility and those that have the technical ownership responsibility meet jointly to talk about the direction that it's taken, looking at the service and design approach, but more importantly, who we have at the table are the people of the city. So we bring in focus groups of people so they can look at the platform as we build to ensure that it aligns with their expectations.
Yeah.
Last thing you want to do is build something and then someone goes, how's this supposed to work?
No, absolutely. I mean, I think that's a really important distinction to make about how you plan on moving this portal forward and making sure that it's doing what it's supposed to do, just because of kind of the history that the city has had with their tech vendors. And so I'm curious to dig in at some point a little bit more about kind of what the feedback is that you're getting from folks who are, the members of like the skilled industry that are going to be able to weigh in on how the portal functions, how it looks. Is that something that is happening now before the vendor is even selected?
No, so yes, it's happening now, and long term, we're not certain whether we would need a vendor to carry this forward or not. So it's currently being done with city resources, and then as we get past this first stage, we'll make a determination on how we press forward beyond that.
I'm curious, kind of in the scenario where something is, where the My City platform is compromised. We don't want that. We feel like, we know enough now to kind of prevent all these worst case scenarios. But would something happening to the My City app have an impact on any of the other agencies? Because, this is going to be a really robust platform that's going to be able to, my understanding is to bring in a lot of the resources that exist and that live in other agencies' websites. Does a worst case scenario for the My City app have any impact for the way the other websites or apps operate?
Yeah, so if that's a complicated question, but I'll answer that in a couple of ways. First is, when we architect systems and we build them to ensure that when something breaks, it doesn't disrupt anything else within the ecosystem, right? It's the concept of building an application or a service that's containerized to itself. So if something breaks, whether someone gets into that system or something mechanically goes wrong with that system, it doesn't ripple to other systems. Now, when we look in the recent past and we look at something like SolarWinds, which was a breach that occurred in 2020. SolarWinds was a network monitoring tool that was used by 90% of Fortune 500s. It was used by the US federal government, used by city and a number of other places. It was discovered that SolarWinds had been compromised by an internal actor, and then there was malicious code embedded into the program. And in that breach, what we later found was that by breaching that one product, nation states were able to infiltrate almost every level of the federal government, right, including our intelligence agencies. So we can't say universally that there isn't a component or a part of a system that can't be compromised. We just work diligently to ensure that we cover our bases for all the things that we know to be vulnerabilities and put compensating controls in place so that if something happens, it limits the blast radius.
Can you, I appreciate the comment you made about obviously wanting to make sure that the My City portal works, right? That it does what it's supposed to do, that it looks good, that people who are using it, people who need it the most, understand how to utilize it. Can you talk a little bit more about the team that you're bringing together of potentially like non-technical workers to be able to get feedback from them? I'm curious, there's a lot of lessons learned. I'm familiar with the Access HRA app. It's something that I use it for my mother. I'm curious to see if there is a cohort of regular New Yorkers that you're bringing to the table, folks that are actually going to depend on this portal, to really ask them about design concepts and kind of what that user experience could look like.
So the typical approach is working with the agencies that perform the business function. So looking at going to the centers where they actually perform it, asking people that are applying for the service if they'd be willing to spend some time to take a look at what we're building, and that's how we tend to recruit our talented test, or at least it's actual consumers of the services that we're delivering.
Fantastic. And they are brought to the table pretty frequently?
Yeah, so it's when there's functionality that's new that we need to test, we reach out to those groups of people to see if they're interested in testing it. And they're a pretty good sounding board because they've either had an experience with the system or service before as they've applied, or they're in the process of going through an application. So they could look at what's coming versus what they experienced and give us feedback based on that.
So they will be asked to participate when there's new functionalities. Right now, they're not being asked.
Yeah, so as we develop right now, we opened our first group so they could take a look at the experience, and we got feedback, and we've adjusted course based on that. And in waves, as new functionality is delivered, we try to minimize the amount of time that we take from people. So we will continue to engage the community as we continue to build.
Can I, where will the data be stored and secured that the portal is collecting from users?
So it will be in a number of places. As it currently sits, a lot of it will be in the city's core infrastructure. We have centralized data repositories where we pull information in to apply context that's owned and operated by the city. And then we have tertiary platforms that are consumers of the data that we bring in. So it could live in places like AWS and Salesforce, where some of our other data lives today.
And some kind of long-term for the My City portal, what is the plan to have the site and the app evolve? How often do you think OTI will kind of be looking at this site and seeing what is working, what's not working? Services might need to change, might need to be amended. How often or how relevant do you think it is to kind of have this website evolve? And how often are you right now projecting that needs to happen?
So as we're in our infancy phase, we're trying to build dexterity and try to establish a cadence that makes sense. The key is to look at your processes often enough where you can make effective change, but not look at them too often so you're always fixing something. As it currently stands, as part of the child care effort, we're not only using it as an opportunity to provide simple access, but we're also working with the agencies that are administering the services in the back end to help look at how they administer those services. So use it as an opportunity to remove friction not only from the end user experience, but from the business process. As we touch each service, we're going to seek to do that. And we already have models in place where we do similar things, like 311. When an agency service change, there's points of contacts that are established between 311 and the agency that's responsible for the service, so that they can communicate those so 311 can adjust their procedures. The same level of maturity and process that we have in place for our customer service operation, we want to employ for our application development operations.
Thank you. I do have a question that I want to ask on behalf of my colleague, Councilmember Holden, who for quorum reasons can't ask the question himself, and it's regarding the Park mobile app. So last year there was the crash and the data breach that compromised about 21 million users. Personal information and emails, addresses, phone numbers, license plate numbers were included in that breach. Although this was last year, Commissioner, this year, what are some of the steps that OTI has taken to increase security and mitigate any of those impacts? And does DOT still work with Park Mobile?
Yeah, so Park Mobile is still an existing vendor of the city. And although a breach took place, if you look at most major corporations, there's been a breach of some kind. Target had a breach, Sony had a breach, no one's giving up their PlayStations, right? So I think for us as a city, it's using these experiences and walking away a little bit smarter from that and looking at how we engage with outside parties for critical services. So doing cyber reviews, looking at the platforms that we're bringing in, doing security architecture reviews, making sure that our riders are established so that define terms and penalties for the ways that when a breach occurs, how you deal with that. From a privacy perspective, making sure that when there's a breach, everyone is transparent and we get that information as quickly as possible so that we can let those that provide that information know what we're doing about it. Those are some of the things that we're doing, but the key is, you ever hear the phrase measure twice, cut once, right? So for us,
of course.
Yeah, exactly. So from a security perspective, it's like assess twice, deploy once, right? So we want to ensure that we not only look at tech as it comes through the contract phase, but as we build, we also ensure that that tech is secure. So in situations like this where we have a third-party provider that's providing a critical service, being able to audit their capabilities, being able to look at their security architecture, ensure that's the best thing for the city, are some of the things that we've done to ensure that we don't trip across this again.
Thank you, Commissioner Frazier, and thank you, Dr. Sterling. I think we did it. I think those are all my questions. I think there are some follow-ups. I know that we can expect some of the answers or some of the more detailed responses through the committee, but I want to thank you both and your teams for being responsive. And I think the goal of today's hearing was not just to get everything on record that we've kind of already heard about the monkeypox vaccine rollout, is we want to make sure that this new office, and we want to support you, Commissioner, we want to make sure that it's not just meeting the expectations of what New Yorkers' experience with the city is digitally or technologically, but we want to make sure that we're exceeding those expectations. And so my questions regarding the My City portal, I would love for a lot of these lessons that we've learned in the past to be included, even under the city's monitor of the new vendor license application system. Like whenever that goes live, making sure that we're using the lessons learned with vendors to make sure that that's not happening. We're in 2022, we're in the richest city in the world. We should be kind of taking all of these experiences in a very serious way, and all of these crashes and all of these mistakes that are being made, we should take these very seriously, because there's no reason why we shouldn't be the model for how OTI operates and how everything falls under OTI. So thank you so much for participating and for your transparency, and we look forward to continuing the conversation.
Thank you very much. We'd like to thank council very much for bringing this out. I'd like to say just two things as we close. One, as Council Member Brewer said, she's a little bit skeptical about how this stuff works out.
That's the OG tech chair, so yes.
Yeah, she's skeptical, right? But you know what they say about faith, right? Faith is, the substance of things hoped for.
Commissioner Frazier, no one lays out an idiom like you, boy. Thank you.
Yeah.
Yes.
It's like, just takes a little faith, right? And I'd say the mayor's already done a number of things to show that he's not like any mayor the city has ever seen. And just stand by. I'm not like any CTO the city's ever seen.
I mean, you're the first one, so that is true.
Yeah.
Yeah. No, absolutely. Absolutely. Thank you so much. Dr. Sterling, anything else?
I just wanted to say thank you.
No,
No idioms, sorry.
Thank you for taking a time out for both of you, your busy schedules, to be here. I appreciate it. Bye.
Thank you.
Now we move on to public testimony. Thank you, Irene.
Sure, Chair, and our next panelist will be Clayton Banks.
Starting time.
Jesus, I forgot all about that. Huh?
Okay, I see that Clayton Banks is not ready to testify. We're going to move to our next panelist, and our next panelist is Krista Riley.
Starting time.
Hi, my name is Krista. I work for Churches United for Fair Housing. So I meet with a lot of people and we try to navigate the Housing Connect website. And throughout the month of July, it has just been really hard to use. It's been either down, or the text verifications to register an account would just none of the text would come through. So yeah, it was just very, very difficult to try to navigate. And it was for the majority of July. The last week, it's been a little bit better, but still pretty slow and very frustrating to use.
Krista, thank you so much. If I can just ask a question about specifics, can you detail what is the challenge that creates for you and CUF, and what are you met with when you log on to the Housing Connect site and, in your words, it doesn't work? What is happening?
So it kind of really can be a little crippling sometimes, just because we do try to encourage a lot of New Yorkers to sign up for the housing lottery, just because there really isn't enough affordable housing. So that usually is a way for us to kind of, encourage people to get on and, set up their accounts, teach them how to use it. And then essentially it would just either, we would get like a screen that said, try again later, or we would just get like a little blue kind of alert at the top of the the website saying like, please use another email. But a lot of times the people that we are with, they only, have the one email that they have access to.
Yeah, Krista, thank you so much for sharing that, and we'll make sure to get that to the OTI commissioners team as well. Thank you.
Thank you.
Thank you for your testimony, and I'm going to circle back to Clayton Banks.
Starting time.
Thank you very much. Very much appreciate the entire day already. And I just wanted to share a quick several comments. And I want to acknowledge the members of the City Council Committee on Technology. Great work that's happening as a result. My name is Clayton Banks. I'm the CEO of Silicon Harlem. And actually, this is a great opportunity to share my concerns and many New Yorkers that want to understand, just exactly how we are addressing critical technology, but specifically challenges both current and future technologies, right? So advanced communications and information service technologies are transforming every aspect of our lives. I recently hosted a group of teenagers where we talked about the technological challenges in future, and the group identified some really cool concerns, ones that you've heard before. But these young people said that they wanted to make sure it gets addressed from the perspective of climate change, the virus itself, rent decrease, the city cleaning itself up, and transit system improved. My point is that clearly this is an opportunity for the city's technological responses to address quality of life issues, can improve by tech-enabled technology driven by civics. We're hearing about the portal that's being created, and we don't want to repeat the same things we've had in the past where it creates divides. So we need to start thinking about, in my opinion, that we build equity into our technology platforms and collectively provide solutions towards our city issues. This requires, in a lot of ways, that New Yorkers create the standards. We don't need anyone else to create the standards for technology. Our public roadmap should actually encourage tech platforms like the metaverse that will obviously come fast and furious, but we need to understand the ethical, safe, and inclusivity that comes with that. All technology guidelines must provide oversight on things like data privacy, security, ethics, physical safety, sustainability, and equity. Finally, all of this requires everyone to have robust connectivity in the home. We're talking about moving all of our civics online. If you do not have connectivity, you are basically not a citizen. That has to be addressed before we do anything. Every single home must have the internet. The next web, we're talking a lot about the current web, but if you start really thinking about, this council has to start thinking about the next web being defined by the metaverse, which looks at physical and digital combinations.
Time expired.
To move it forward. I will finally say thank you for allowing me to share this. There's much more I would love to talk about the metaverse with this committee so that we are prepared for all of our citizens to be part of the future. Thank you very much.
Thank you, Mr. Banks. We look forward to working with you at the next couple of hearings and conversations. And with that, we have no other testimony, so we will conclude today's hearing. Thank you so much to the entire team. Adios, everybody.